His Excellency the Governor of Tamil Nadu and Chancellor of the University, Honorable Minister for Health, Tamil Nadu and Pro-Chancellor of the University, respected Vice Chancellor, Madam Health Secretary, DME, DMS, Director of Indian Medicine, awardees, students, and all those assembled here. I am deeply honored by the invitation of the M.G.R. Medical University to deliver the 24th Convocation address of this premier university, the second largest health sciences university in India. I recall with nostalgia that evening in August 1950 when I waited in the same historic Senate Hall for the famous Madras University, the first university in India, 1857, to receive my MBBS degree from that renowned personality of the revered memory, Sir Dr. A.L. Lakshmaswamy Mudaliar, with mixed feelings of elation, aspiration, and apprehension. Elation at achieving my ambition of becoming a medical graduate, apprehension of what the future held for me. Many of my young friends opposite, I'm sure, are stirred by similar emotions today. Let me at the outset congratulate the new graduates, the specialists and the super specialists who are taking their degree today and wish them an excellent, brilliant academic career. My best wishes and regards to those who are honored with their doctorates and their Lifetime Achievement Awards. To the graduate, I wish to say that this graduation day is just the beginning. You have just completed your formal training and have a long way to go. You are now starting your life's journey. You have to decide as to what you want to be, your aspiration for the future. The options today are numerous, and you can be a good clinician practitioner, a specialist, super specialist in the area of your choice, a teacher, a research scholar, and many, many others. You must, however, remember that there must be a continuing acquisition of knowledge. It is a lifetime process. As one who has taken the path of Hippocrates, you have to abide by the code of conduct and code of medical ethics originally conceived by Hippocrates and adopted by the Geneva Convention, 1949. There have been many revisions. Basically, all of them take as their guiding principle the concept of service to humanity and respect for human life and to do no harm or malice. Hippocrates in 460-377 BC, the great physician, considered father of medicine, laid down certain basic guidelines for medical practice and which is considered a model for ethical practice. It was an era when medicine was an art of healing. It was said that the physician heals by listening to the patient. Medicine was considered a work of service, saving life whenever possible by giving the best of our ability, with saving when saving was not possible, relieving and comfort. The doctor-patient relationship was very special, sacred and unique. With advancing science and technology over the centuries, practice of medicine has become science and an art. That was brought in by Sir William Osler, again a very great physician. The last 6 decades have witnessed a phenomenal change in the medical scenario, and some of us have had the privilege to have been part of the change. Conceptual influences have played an important role in scientific progress in medicine, derived from meticulous clinical observations, astutely and scientifically construed, tested and verified in the laboratories. They have formed the basis of many epoch-making discoveries. The tragedies of the lying-in fever stirred the suspicion of transmission of disease by unwashed hands and unclean instruments, leading to the concept of infection, discovery of microbes, the Listerian era of antisepsis, and many, many others. The introduction of vaccines introduced the concept of disease prevention. The discovery of antibiotics and astounding advances in medical technology, as in diagnostic imaging, including ultrasound, CT scanners, MRI, nuclear imaging, gamma camera, PET scan, and whatnot, have enhanced our diagnostic capabilities in early detection and diagnosis of disease. The advances are too many to be enumerated. Phenomenal changes in therapeutic technology in every area of medicine have made organ transplantation, including breast, kidney, liver, and many other transplantations, routine procedures, although much more needs to be done. Organ conservation is also another advance in areas where mutilating surgery should not be done to improve quality of living. Today, minimally invasive surgery, robotic surgery, targeted therapy, and whatnot are phenomenal advances. But the dawn of the genomic era and the introduction of molecular diagnostics have revolutionized concepts in Medicare and brought in the era of personalized medicine, enabling tailoring of treatment based on biology of the disease. So the progress has been phenomenal. This record my personal thanks and gratitude to the Honorable Chief Minister of Tamil Nadu and the Government of Tamil Nadu for all the support and for all the recognition of cancer as a major health problem. I think we need to do much more. But I think we need also to do more for the non-government charitable institutions. The enhancement in knowledge and technology has resulted in proliferation of specialities, subspecialties, and super specialties, which have been responsible for the spiraling cost of medicine. This is a matter for concern. Medical education, however, has not kept pace with this changing medical scenario and advances in scientific technology and knowledge. Medical education has generally been oriented to tertiary care. Primary care and prevention have received low priority. Again, thanks to the Chief Minister of Tamil Nadu for giving a prominence to these areas. In today's changing healthcare scenario, with increasing trend in non-communicable diseases, the thrust has to be on prevention, and it will thus be necessary to reflect this in the undergraduate and postgraduate teaching. Science and technology are so dominating medicine that the art component, which is the crucial caregiving component, has been forgotten or virtually disappeared. The critical balance of science and art is lost. Introduction of humanity and training in communication skill is an essential component that needs to be addressed both at the undergraduate and postgraduate level. With increase in sophisticated technology, medical training has to include ethical issues. Technology, despite its contribution to better and earlier diagnosis, better survival, quality of life, etc., has also enhanced the physician's responsibilities, not only to contain Medicare cost, but many other issues, including ethical practices. For example, the availability of high-tech should not be the reason for its use. One has to carefully consider where it is to be used, which is better, under what condition, what is the cost benefit, and many, many other factors. The interpretation of these technologies needs training. Many of these do not find a place in textbooks, nor are dealt with by teachers during student and postgraduate training. Technology assessment, carefully evaluated evidence-based practice becomes mandatory to provide guidelines for therapies having clear scientific basis. Evidence-based guidelines cannot be blindly followed. They provide the existing information on the basis of pooled data. However, they should be used based on individual experience and needs individualized decision making. Just a word about quality in education. The progress of a people, whether in economy, industry, public health, social living, or political understanding, is basically and fundamentally linked to their standard and quality of education and its universality. The country's educational statistics, as reflected in the census 2011, needs a careful re-evaluation. The literacy rate is reported as 74.04%, male so-and-so, female so-and-so, and with great ado as well. But if one were to examine it more carefully, the definition of literacy is something that we have to think of. Many a time, it is just learning, knowing to read or write their address or their name. I think literacy, certainly literacy, cannot be education. The highest educational enrollment ratio is 12% in India, which is near on 50% in all developed countries. The data for professional education is specifying medicine 0.16%, engineering 0.32%, and others 0.3%. We may be slightly different in Tamil Nadu, but this is a generality in India. We are also painfully aware of the large number of unemployable qualified who are also categorized as educated. The unemployable group is spread over many areas, including, I'm sorry to say, medical professionals, engineers, teachers, paraprofessionals like nurses, etc. In all these areas, we have to ensure that merit be the sole criterion in any selection process. I think this is going to be vitally important if we need to change the scenario. In the final analysis, it should be borne in mind that the proportion of well-trained ethical general practitioners are as vital to the health of the nation as the generation of specialists. In this context, it would be worthwhile to consider introducing the concept of qualified general practitioners, the training of a GP as a specialist or a specialty with mandatory upgradation CME programs and following the Australian health delivery system, where no specialist is permitted to see a patient unless referred to by a competent general practitioner, and this can be very useful. The Code of Conduct of GPs holds a general practitioner responsible for reference to a specialist when indicated and without delay. Quite often, I found in Australia, the GP is much better informed than the specialist. The GP plays a pivotal role in efficient healthcare delivery and early detection and prevention areas of healthcare. What is quality in healthcare? The definition of quality in healthcare is certainly not easy. The indices for measurement are many. Standard guidelines have yet to be framed. In my personal perception, it has to include survival, mortality, morbidity, preventable deaths, avoidable morbidities, quality of life, patient-family satisfaction, and numerous other clinical issues. But most importantly, it should be accessible, affordable, and equitable. I think that is going to finally decide where we are in healthcare. The medical and paramedical professionals, I believe, must accept their responsibilities in achieving these objectives and targets and not leave it to governments alone. Now coming to ethical practice, I would like to mention just a few more words. The oath of Hippocrates has laid down certain codes of conduct. The World Medical Association has adopted a version of the Hippocratic Oath titled the Geneva Convention, the Code of Medical